And welcome to the Factor Uncensored. The big countdown is on for us to break bread with family members, friends, and even some damn enemies we have to keep a close eye on. But before we go around those loved ones and frenemies, we want to make sure we are healthy as we approach Thanksgiving, because the last thing you want to do is piss off your relatives saying you brought that damn COVID to my crib. Let's talk about what you need to do to prepare with Dr. Danish Ali at Archpoint Pain Institute.
Dr. Ali, it is that time of year where we will be traveling, visiting family members and friends, and some of those family members are aging. And while COVID is not the big concern right now, a lot of people out there are having upper respiratory issues, including myself. I found myself sick last week with the flu. So if you're visiting people out of town or people are coming to your home, what health precautions should we take before we make those trips?
Isaiah, that's correct. We are seeing a number of cases rise. It is the trifecta that we're encountering right now, which is the COVID along with the flu, the influenza, and cases of RSV. All three of those have been rising here in this city, in this county, and we are now going to be seeing, with the holidays coming as well, and people being more indoors with the colder weathers, we are going to start seeing a further increase in those numbers. So yes, I agree with you, Isaiah. We are going to see this numbers rising here in the city, and we will continue to. And the things that we can do to prevent that and to help us is to use a lot of those sanitary things and things that we've already been discussing as it relates to the COVID. We are now a year, almost 2 years into this pandemic. We've had vaccinations as well, and now we have seen the success results of these vaccines, and now it is time to get those boosters as well, as we've talked about. Furthermore, the flu, it has a vaccine as well. That can also prevent some of the severe symptoms, and as well as preventing the flu itself. And also practicing clean, safe hygiene, which is washing your hands thoroughly for at least 30 seconds, keeping a hand sanitizer with you as well. And also, if you're indoors, if you are immunocompromised, or if you're around folks that may not be vaccinated, put that mask on for a little bit and help protect yourself and protect others.
And one of my biggest concerns, the elderly. If they're at the family gathering, at the family dinner, should they be wearing a mask just to be safe for them?
That's correct, Isaiah. That's what we, it all depends on the individual. They have to make that individual choice. However, in the medical community, we do recommend it. And the reason for that is because you may be contagious, or you may be around people that may not be vaccinated and they may be contagious. And we know that the elderlies have more medical comorbidities. They're at higher risk for diabetes, blood pressure, other comorbidities, especially the lungs, that puts them at higher risk to develop the severe symptoms and also be hospitalized.
Now, what about the children? Obviously, the children will be seeing grandma and grandpa for the first time, and then they're also seeing a record number of hospitalizations for respiratory problems and illnesses as well. So what would you recommend for your children who may be around the grandparents or around a lot of adult relatives?
Isaiah, if the kids are having any symptoms, any upper respiratory symptoms, whether it be a runny nose, watery eyes, fever, chills, not eating, lack of appetite, those sorts of things where they are feeling sick, we need to practice that judgment and try to keep those kids away from the elderlies, away from folks that they may spread these viruses and diseases to. And as we know, for example, with RSV, most cases are mild. Most of the kids recover with it. However, it's those, that we can prevent those other folks from getting it as well. And especially in the elderly population, where they may have other comorbidities, other issues that make their recovery a lot more difficult.
For those who may be traveling out of town and they want to get those last minute COVID vaccines and flu shots. Is there a time frame before you travel, or you can go as you're leaving out of town, stop by the pharmacy, get it, whether it's free or through your insurance? But is there a timeline to get it before you go out of town? Something recommended?
Yeah, recommendation is, Isaiah, to get it done sooner than later. And the reason for that is because the immunity takes a few days for it to kick in. So it's not like you can get on the car and travel to your family's house, and on the way you stop and get the vaccine. It doesn't work that fast. And so if you are traveling for the holidays, if you're seeing your loved ones, now is the time to do it as soon as possible before the holidays arrive, because you want to let that immunity build up in your system.
Any recommendations for traveling? Should we have any concerns about being in close quarters in a car or on an airplane or whatever method of travel you may take? Any precautions we need to take or be concerned about?
Isaiah, we're still recommending the mask right now, Isaiah, especially when you're in closed environments with folks who may be coughing, who may be unvaccinated, who may have the flu or other illnesses. And so we're still recommending that. Still keep your little hand sanitizer bottle close to you as well. Wash your hands consistently. And again, if you don't feel well, stay home and try not to infect the other folks if you can.
Better safe than sorry this holiday season, because obviously we have Thanksgiving coming, then we have Christmas, New Year's Eve, so we have to take those precautions.
That's exactly right, Isaiah. And if you can, FaceTime your family, let them know you're not feeling well, and you're protecting them, and you're protecting yourself. And we're at this point, Isaiah, where we understand, parents, our elderly population, they get it. And the key is to protect these folks as well.
All right. Well, always good to talk to you, Dr. Danishaw Lee with Arch Point Pain Institute. For those who would want more information from you, they can reach you there. And of course, they can find you on social media and Instagram.